Hello, everyone. The dogs are welcoming you as well. Today, we are going to be talking about hand, foot, and mouth disease. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And I do have a dog walking around here trying to put a tennis ball in my lap at the same time. And we are joined by the fabulous paediatrician Dr Deb Levy and her two dogs as well today. We don't have kids with us because they're all at school.
No.
Oh, actually, no. I lie. I've got one at home, one at home sick, but that's okay. Hence the reason working from home. But Deb, for those who haven't joined us before, could you please introduce yourself?
Thanks so much, Sarah. Always so great to be with you. Don't know why my voice suddenly got croaky. But my name is Dr. Deb. I'm a holistic pediatrician and mom of two girls and two dogs. And when I'm not in my practice in Sydney's eastern suburbs, I really love being here with you to teach you some really valuable tips and tricks and the facts that you need to know so that you don't have to go to Dr. Google.
Exactly. So Deb and I are both joining you from Gadigal and Bitchigal land today, and we would love to, one, know where you're tuning in from, and two, please ask any questions. Pop them in the comments below, and while we are live, so sorry if you're watching this as a recording because we can't actually answer your questions then, but if you are watching live, please pop them in the comments below. And the other thing that we would love you to do is please tag any friends who you think will benefit from this information in the comments below as well, because that's why we're here. We want to give you good evidence-based information that can be shared around. So
exactly.
we're talking about hand, foot, and mouth today. And Deb, I know you're just going to go, because I'm going to say my kids have had hand, foot, and mouth multiple times. Have yours?
No.
No, I knew it. I knew you were going to say that.
I might say, Sarah, you make me feel like my children are exceptionally healthy.
My kids have had everything, but mind you, they've had everything quite mildly, which I think is, probably the better end of the spectrum. That's pretty nasty broken bones, but that's part and parcel of it too. But even one of my kids has had hand, foot, and mouth multiple times. So how about we start with what is it? And we hear about it all the time. It's obviously quite common. So what causes it?
Absolutely. I mean, it's really common. It's a typical viral infection of childhood. Usually the preschool or school-age children, they say under the age of 10, it's most common. Mm-hmm. A couple of viruses can cause it, the most common being Coxsackie virus. That's a very academic answer, but it's your typical viral infection that children get.
Mm-hmm. Yep, absolutely. Sorry, I'm just getting flashbacks to really remembering, and also because I did end up with it myself as well, but luckily very mildly, thank goodness. But anyway, because it's so hard to keep away from kids when they're sick, especially when they belong to you.
I know, right? You do feel a little bit guilty if you don't give them those kisses and cuddles that they want.
Yeah, exactly. So what does hand, foot, and mouth look like? Can you describe it to us?
Well, look, I mean, it's named obviously because of what it does, and it causes, as I said, so it's a viral infection, so it usually will cause a low-grade fever, and maybe a bit of tiredness, your child being a bit grizzly, a bit of food, those typical kind of non-specific symptoms. But then hand, foot, and mouth, so on the palm of the hand, on the soles of the feet, so that's the bottom of the feet, and around or inside the mouth, that's where the rash is. On the hands and feet, it looks like little blisters. And in the mouth, it can look like ulcers. So as such, it can actually be quite an uncomfortable rash. And really, with the mainstay of treatment of this virus and this infection is around symptom management, and that symptom being pain and discomfort. So those of you who have listened to me before know that I never jump to using Panadol, so paracetamol, or ibuprofen, not to use trade names here, or acetaminophen if you're tuning in from North America. So, I never jump into using, antipyretics, that's the actual formal term when you're using it to bring down a fever. But when it comes to pain, I'm much more liberal with using it because, in my opinion, there's no reason for a child to be in pain.
Yes.
But before we go into the treatment, I guess, well, what else? What else do you think we should chat about, Sarah? I'm happy to. It's not an itchy rash, as I said. It can be a bit tender.
Yep.
It's very infectious, very contagious.
Yes.
So typically, once a child has been exposed, it'll take about 3 to 4 days for them to then display signs that they're infected too. And the evolution of any blister is the same. It starts as a little bump, it becomes fluid filled, and then it crusts over. And when it crusts over or totally goes away, that's when it becomes less infectious. Obviously, your child can also cough and splutter, and if they're doing that, they're also infectious. And obviously, when they still have an active fever, that's another reason to keep them at home and away from school and away from other children.
Absolutely.
The other confusing thing is that hand, foot, and mouth disease can actually sometimes cause a different kind of rash. And then the diagnosis is a little bit more tricky, and that can be just a red rash with a bit of brown, like a bit of brown discoloration, a little bit of brown scaling. But that's something for your doctor to diagnose is a little bit more unusual.
Yeah. And speaking of the rash as well, one thing what you said just really jumped out at me, how it's different to the chickenpox rash, whereas chickenpox rash is itchy, whereas this one is actually painful. And I remember when my youngest had hand, foot, and mouth, and she had a decent, dose of it. You could tell her hands were sore. She would hold them and she didn't want to grab things and touch them, even though that's developmentally, that was where she was at. And her mouth was incredibly sore as well. And I remember I just got a couple of lesions, like nothing really on there, and they were sore. When you actually touched them, it was painful. I was like, well, no wonder she didn't want to do that. But the other thing as well is that, are we just limited to the rash on obviously the soles of the feet, the hands, and the mouth, or can it be in the nappy area as well?
Oh yeah, it can also be in the groin area, and it can kind of be anywhere really. But it's hard to make that diagnosis without seeing them in those specific areas. So it can be beyond those areas, but it should usually involve those areas.
Excellent. Very good. So what should we do? First, actually, no, let's back that up a little bit. How at home if our, one child's got hand, foot, and mouth, how can we prevent the spread to the rest of the family? Is it possible to do that?
Well, theoretically it is, but I'm not sure how practical it is, which is why often it does spread around the family. So as you tested to already, look, it's all about minimizing contact, both direct physical contact, being in someone's close vicinity. Remember I said that droplets spread through the breath or through coughing and sneezing, direct contact obviously, and also through sharing things. So you don't want your children sharing toys, towels, food, utensils, etc. Or even just digging into the same bowl of popcorn, for example. So it's about maintaining distance as much as you can. But it gets really tricky, and obviously always hand washing frequently.
Yep, always. And I think we're very good at that now, with COVID times. I think we're excellent at it. So the two things that, I'd love us to talk about now is, one, what can we do at home to help our kids' comfort, to obviously, it's a viral infection, so we need to write it out. And when do we need to see the doctor?
Sure. Look, as I mentioned already, the treatment is symptomatic. So as with any virus, any common cold virus, there is no specific treatment for it. Antibiotics will not help with hand, foot, and mouth disease. It's about symptomatic treatment. So the two main things we're looking for here are, one, are they maintaining their hydration? And obviously the younger a child is, the more important this is, because the quicker they can become dehydrated. So how do you monitor for hydration? Other than actually measuring exactly how much they're drinking, which is obviously valuable, but not so practical if you're breastfeeding. The other way to do it is actually to measure their output. In other words, how many times they're urinating, how many times they're making a wee. So for younger children, it'll be monitoring how many nappies they're having and how heavy they are, comparing it to what they normally do. And obviously age dependent will dictate how many wees you expect from a child. So it is very, very important to monitor their hydration. And that may mean, offering shorter, smaller feeds, and switching the type of feeding you give, but I think I'm going to talk about that a little bit more with pain control.
Okay.
So the way that I look at pain control is it's either topical or ingested. Ingested is your pain relief. So that's going to be your paracetamol, acetaminophen, or ibuprofen. And you give that according to, the child's age, weight, and obviously the frequency that's safe. The topical one actually fills a bit of a bigger bag of tricks, I think, for hand, foot, and mouth disease, because there are quite a few options. I think the easiest one is usually a cold drink or icy poles. If you're a fan of bone broth, now's the time to freeze some into some popsicle molds and keep them in your fridge and use them for moments like this. So, it's giving them an icy pole. Just being aware, of course, that if it's straight out of the freezer, it can have that, can be a bit sticky, and that's the last thing you want. So maybe just run it under a little bit of water just to start melting a little bit to give them that cool sensation in their mouth. The other wonderful, wonderful trick is actually a topical anesthetic that has to be, you have to go and get from a pharmacy. It's something called xylocaine viscous. And what that is exactly what I said. It's an anesthetic. It should not be swallowed, but it should be applied topically. So the safest way to do this, because unless you've got an older child who's very capable at gargling, in other words, swishing it around and spitting it out, what you want to do is get a Q-tip, cotton bud, dip it in a little bit, and literally paint it on the spots. I think that's the easiest. If they won't let you anywhere near them with a cotton tip, then get a bit of gauze or something on the tip of your finger and do the same thing. And you can apply that, as per your doctor's instructions. It's usually a few times a day, and usually what I say around about 15-20 minutes before a feed, to optimize the chance that they're going to actually drink. And that's why we're doing it as well, to make sure they maintain their hydration.
Yep. And it's keeping up that pain relief too, because kids are so smart. Babies are smart. If they're going to feed and it hurts them, they're going to be much more reluctant the next time they go to do it too. So getting that good pain relief on board, so when they actually do start to feed, that it is better, rather than that learning and just going by association, going, no, I'm not even going to try that. I think that's an important thing too. And if you do have an older child who you have given some of this numbing or anesthetic gel to, be really careful about them having hot drinks as well, because they're not going to be able to judge the heat of that. So making sure that you are testing everything before they go to eat it. Certainly, with the older kids, if, I'm not talking, the toddlers, you should be checking that, of course, before them. But with the older kids, they're not going to be able to judge. They can end up with burns. So make sure you're testing any warm foods that are going to them as well. So, anything else that you want to add to that, Deb? It's one of those things that's really, really common. I'd say that the majority of people who are watching this are going, I've been there. And every time we go into a childcare centre and do any first aid training, one of the main questions they ask is about this hand, foot, and mouth, because the majority of them can spot it at 50 paces and they have seen it hundreds of times. So it's likely you're going to come across this at some stage, unless you're incredibly lucky like Deb, who really hasn't come across so much of this, which is good. But if you have any questions, now is the time to ask. Please pop them in the comments below. And of course, the one thing that we always want you to do is let us know what you want to hear. See, there we go. Is that Millie who's barking at us, wanting to, she's putting her 2 cents
I think it's
worth
both
as
of them.
well. So we want to know. We want to bring you the things that you want to know about. So please remember, DM us or pop it in the comments below, and we'll endeavour to bring that to you, please. Okay. So it doesn't look like we've got any questions today. I think we covered it quite thoroughly as well. But remember, it's all about that pain relief so that we can keep them hydrated. And remember, always, always, always seek medical help if you are concerned about your child. Really, really important. So thank you very much, Deb. We will see you all next week, same time, 2 p.m. Sydney time next Wednesday. Okay.
Great.
See you later,
Keep warm, everyone. Bye.
Yes, it's freezing.